What happens when the person sworn to heal and protect becomes a harbinger of death? The story of Dr. Michael Swango, also known as Dr. Death, is a chilling reminder of the trust we place in medical professionals and how that trust can be devastatingly betrayed. Over a span of 2 decades, Swango used his position as a physician to poison his patients, coworkers, and even friends. His methodical approach to murder, coupled with his charm and intelligence, allowed him to evade suspicion for years. This video explores the sinister double life of Michael Swango, the psychology behind his deadly actions, and the forensic investigation that finally brought him to justice. Join us as we delve into the dark world of a man who turned the sanctity of medicine into a weapon of terror. Michael Swango was born on October 21st, 1954, in Tacoma, Washington, into a family marked by dysfunction and strict discipline. His father, John Virgil Swango, was a career military officer who served with distinction in World War II and Korea, but returned home a deeply troubled man. John's heavy drinking and erratic behavior created a volatile home environment, one that shaped young Michael's outlook on authority and discipline. Swango excelled academically and displayed an interest in science from an early age, earning a scholarship to Quincy University in Illinois, where he majored in chemistry and pre-medical studies. While his academic achievements impressed peers and professors, Swango's fascination with death became increasingly apparent. He collected newspaper clippings about fatal accidents and disasters, a habit that many dismissed as morbid curiosity, but would later be recognized as an early sign of his dark predilections. His time at Southern Illinois University School of Medicine revealed more red flags. His peers noticed he was uninterested in patient care, often skipping clinical rounds to attend to his macabre hobbies. Despite these concerns, Swango graduated, albeit with less than glowing reviews from his instructors. His dark interests and troubling behavior would soon escalate, leading to a series of chilling events that would shock the medical community and beyond. Swango's crimes began almost immediately after he entered the medical field. In the early 1980s, during his residency at Ohio State University Medical Center, he was assigned to care for critically ill patients. It was here that nurses and colleagues noticed a disturbing pattern. Patients under his care suffered sudden, inexplicable deaths. One patient, a middle-aged woman, recovering well from surgery, died shortly after Swango administered her medication. Suspicious nurses reported their concerns to hospital administrators, but their warnings were dismissed due to a lack of concrete evidence. Swango's outward charm and medical credentials shielded him from scrutiny. His methods were chillingly precise. He used substances like potassium chloride and succinylcholine, which could induce cardiac arrest or paralysis and were difficult to detect without specific toxicology tests. His fascination with control extended beyond his patients. Swango also poisoned his coworkers, contaminating their food and beverages. In one case, several staff members fell violently ill after consuming donuts he brought to work. His victims experienced symptoms ranging from nausea and seizures to near-fatal episodes. Swango appeared genuinely concerned, even offering assistance, which allowed him to deflect suspicion and continue his crimes. Swango's ability to evade justice was facilitated by systemic failures in medical oversight and his skill at manipulation. Despite being terminated from multiple positions due to suspicions of misconduct, Swango consistently secured new jobs by providing forged recommendations and glowing references. His career spanned several states, including New York, South Dakota, and Illinois, leaving a trail of unexplained deaths in his wake. Hospitals often chose to quietly dismiss him rather than investigate further, fearing litigation or reputational damage. In one particularly horrifying stint, Swango worked at a missionary hospital in Zimbabwe, where patients mysteriously began dying under his care. Nurses noticed strikingly similar patterns of sudden deterioration in otherwise stable patients. Swango abruptly left Zimbabwe when his activities aroused suspicion, but not before claiming several more victims. The fragmented nature of medical licensing at the time, combined with inadequate communication between institutions, allowed him to exploit gaps in the system repeatedly. Eventually, Swango's luck ran out. He was arrested and faced justice for his heinous crimes, but not before leaving a lasting scar on the medical community. The legacy of his actions serves as a grim reminder of the importance of vigilance and accountability in the medical profession. His story underscores the need for systemic reforms to prevent such tragedies in the future. The forensic investigation that finally led to Swango's downfall was painstaking and comprehensive. In 1997, while applying for a position at a Veterans Affairs hospital in New York, routine background checks revealed discrepancies in his employment history and previous poisoning allegations. Investigators reopened several suspicious deaths linked to Swango's tenure at various hospitals. Toxicologists exhumed bodies of suspected victims, finding traces of potassium chloride and other substances consistent with his known methods. These findings, combined with his detailed journals, where he recorded his fascination with death and described his crimes, formed a damning case. The journals revealed a man obsessed with control, often expressing satisfaction in the chaos he created. Witness statements and corroborating medical records further solidified the evidence against him. Swango was arrested in 2000, charged with multiple counts of murder, fraud, and making false statements. Prosecutors presented an airtight case, leading him to plead guilty in exchange for life imprisonment without the possibility of parole. Michael Swango's story raises haunting questions about the safeguards meant to protect patients from predators within the medical profession. How did a man so clearly unfit for the responsibility of healing manage to exploit the system for so long? And how can society ensure that medical professionals are held accountable for their actions, especially when lives are at stake? Let us know your thoughts in the comments below. Don't forget to like this video and subscribe to the channel for more in-depth true crime stories.